A new study on COVID-19 boosters shows just how important they are. Joining us to talk about this, Dr. Bill Hartman, principal investigator for the UW Health Pediatric Moderna COVID-19 vaccine trial. Doctor, great to see you. Let's talk about this new study coming out of Yale. Incredible numbers. They say if 80% of the current public took the COVID boosters, it could save 90,000 lives. I mean, this is emphasis on how important the COVID boosters could be.
Right, especially going into these winter months where COVID tends to kind of take over and surge. They're thinking that, with new variants that are potentially forming, we see it in the UK, that we could see a surge coming up. And so getting the booster to uplift your immunity is really important. If we just got the same number of boosters as we do flu shots in the U.S., you could probably save 75,000 lives and 750,000 hospitalizations. If we can get that number up to 80% of people boosted, you're looking at saving 90,000 lives, 950,000 hospitalizations, and about $56 billion to the U.S. economy.
The bad news is we're not on pace anywhere close to getting to 80%. I think Americans over 50, they're only at 36%. If we don't get to the 80%, does this show just how deadly COVID still is? I mean, will we get to 90,000 more lives lost?
It's highly possible. The prediction in these models by this Yale study show that if we stay where we are currently, we could get back up to 1,200 deaths a day in the U.S., something that none of us want to see or go through again.
Yeah, we hope that we don't see that. I thought what was fascinating about this study, it talked about something we don't talk about a lot, and that's the financial impact that the pandemic has had. It makes sense. I mean, this study says if people get boosted to the 80%, it could stop 1 million people from going to the hospital. Obviously, if people aren't going to the hospital because they've gotten the vaccine or they don't get COVID, that saves our country a lot of money.
Right, and the hospitalizations for COVID are complicated. They require a lot of one-on-one nursing. They require a lot of PPE still to be worn. Special rooms for things for surgery. And so these numbers are real numbers. All of these really add up and really take a toll on our whole health system. All
right, a clear message here. If you're eligible for that booster, there are some serious impacts it can have and benefits as well. Dr. Bill Hartman from UW Health, appreciate your time.
Thank you.